Sorry for that. I'm a bad moderator. The next speaker is Marie, yeah? And she's a graduate of biomedical engineering and a PhD student in digital health at the University of Bristol in England. UK or England?
UK. Yeah. Is it just this button to go to this one? Yeah. Excellent. Hi everyone. I won't embarrass myself by asking if there's any Scottish people in the room, because I'm pretty sure I know the answer to that. But it's lovely to meet you all. I am Mary Deighan and I'm from the University of Bristol in England. And today I'm going to talk about my PhD work that involved collaborating with patients and clinicians in the UK's National Health Service, the NHS. And if you think of Harry's talk as how to scale up VR, this is more how to start up VR, this talk, okay? So we're slightly behind a wee bit in the UK on the VR scene. But before I get into my work, I'll just do a quick introduction. So about 5 years ago, I was finishing my master's degree at the University of Strathclyde in my hometown of Glasgow. And I was lucky enough to work on an incredible project with my supervisor where we were playing about with spatialised sound engines in VR and trying to find out if we could actually develop a diagnostic tool for testing for single-side deafness in children. And this was my first introduction to medical VR, and it was also my first introduction to VR technology in general. And I was absolutely hooked from day one. I just thought, this is the field I need to be in. It just felt so exciting, and I decided that this is going to be my focus. So I headed down south to England, to the University of Bristol. And at 21, I was bright-eyed, bushy-tailed. I thought, VR, I think I'm really on to something here. Brennan was saying we've got lots of founding fathers of VR. I thought I was the founding father of medical VR in the UK. I just thought, listen, when people hear about this, they'll go wild. So that is when I started reading into the history of VR. And I realised it's not new. And I was absolutely shocked. I was gutted. I thought, no way. And I was reading these papers back from like the 80s and the 90s, and they were strikingly similar to the papers I'd read, a year ago. And I thought, well, wait a minute, VR is a lot older than me, and I've not heard of it, and I've not heard anyone talking about it. And this was into after the end of my 5-year degree in bioengineering with a lot of overlap in digital health, and it had never been mentioned, not once, until this end point. So I was shocked at this, and I thought, what are we waiting for? And really that question has been the kind of groundwork and the foundation of my PhD research. As in the UK, I just thought, what is it that we're all waiting for here? Now, granted, I was quite naive, but, maybe I still am. But I thought, I believed in this technology and I believed in it for our healthcare service. So I basically just wanted to kind of go on this mission and find out why in the UK I wasn't seeing VR anywhere. And I wanted to start just understanding the questions why. So I moved to Bristol and I started my PhD in digital health and care. I'm funded by Great Ormond Street Hospital in London and also the Engineering and Physical Science Research Council in the UK government. And I partnered up with the Teenage Cancer Trust. And what was really amazing about this project is I had the luxury of being extremely exploratory, which you can't always afford to be, and especially in industry. So I basically contacted the Teenage Cancer Trust, who are the leading teenage cancer charity in the UK. And I was quite transparent. I just said, listen, this technology is amazing. It's not being used anywhere here. Why don't we partner up and see if there's anywhere that it can offer benefit to your patients? Now, the reason I chose oncology, there was a few reasons behind that. First of all, oncology obviously spans so many disciplines. You've got this kind of first kind of core care team, but then you also bring in a lot of extended care teams where you're bringing in mental health care, social care, a lot of domains, and what's perfect about that for medical VR is that any uses I was going to find are going to have some overlap to a young person with cancer. And the other part is teenagers and young adults are often an overlooked and underserved population. And at the time of starting this research, the teenage and young adult and the UK is defined as age 16 to 25. So I was just leaving this demographic and I thought, you know, this demographic stands to benefit a lot more, so much from the integration of digital technologies into care pathways, and they're extremely tech savvy. So I thought there's no better place really to use as a test bed for medical VR. So the first study I want to talk about in my PhD is a co-design study that I ran with a small group of young people living with cancer. And I actually reached out to them to ask if they minded showing their pictures. And the minute I said, you know, it's in Beverly Hills, LA, they were like, whoa, yes. I think they thought Tom Hanks would be in the audience. But anyway, this is my group of young people. And the reason I chose co-design, which is an HCI method, is co-design is such a great way because when you ask someone to kind of speculate or think about an idea, it stays hypothetical a lot of the time. And what's such an amazing value with co-design is it takes ideas past speculation. It brings an idea into physical existence. It gives you something tangible to work with. And what's really great about coming from a place where our technology has not yet been introduced is we have this golden opportunity to actually think about the practical implementations and the feasibility of the tech right at the start, because we've not deployed it a lot. We've not got deployment where we're now seeing lots of issues. We're not even there yet. So I really thought this method lent itself well to such an exploratory project. And I also wanted to find a way to meaningfully engage with young people living with cancer, sort of going beyond tokenistic evaluation and consultation, and actually be quite transparent and say, listen, I think that this technology could offer you a lot of benefit, but I actually don't know if it will, so why don't you come on alongside me? And kind of it takes away that dynamic of research and participant, and it's kind of feels more collaborative in nature. So the kind of aim or more shared goal of the team of researchers and co-designers was to co-design novel VR applications. So I didn't want to kind of show them straight away what was out there. I wanted to say, like, right, pretend you don't know, and actually a lot of them didn't have any experience with VR. So go blue sky thinking and think, okay, anything's possible. What actually do you need? And I think that's really important because it kind of reduces the risk of just trying to shove VR into healthcare. It actually finds the challenges first and then says, okay, is there any place for VR with these challenges? So I adopted sort of a generative co-design framework where we started off with this first workshop, which was just all about getting to know the young people and asking them to share their experiences of going through cancer. We had a group of young people that were from all different ranges of the pathway. So I had some people who were newly diagnosed, and I had other people in active treatment, some in remission, and also we had a few co-designers in palliative care as well. So we had quite good representation across the whole cancer pathway. And we asked them to critique some personas that I'd actually made based on a clinician interview study I was done, so it was quite fun to watch them totally tear some of that apart. And then they also shared some positive and negative experiences of their experience going through cancer care. So we then moved on, and I'm going to fly through workshops 1 and 2 because I think the real interest kind of is in the further 3 and 4. But the second workshop we called Becoming VR Experts, and this is when I had their experiences mapped out, and then we said, okay, now we're going to train you guys up to see what, show you the latest and greatest of VR. So I showed them some, we did actually have a mobile VR headset somewhere lost in the university, so they were able to trial where it kind of started, well, not started, but where it started, and then kind of where it was, and they had quests, and we showed them a whole range and got them to evaluate some apps as well. So workshop 3, we've found out their kind of experiences and challenges. They know now kind of about the technology, what it might offer, and this was the workshop where it was all going to come together and they were going to have all these ideas. And I must say, before this workshop, I was worried sick. I was so nervous because I just suddenly thought, oh man, I said, with exploratory research, you obviously need to be prepared for the eventuality that you're just on the wrong track. And obviously I'd read all this research about medical VR and I knew that there was potential there, but I thought maybe this group are going to just say thanks, but no thanks, not for us, not here. But oh man, was I wrong. This session was utterly electric. It was one of the best things I've ever been involved in as a researcher. And it was the sort of synergy between the researchers and the co-designers. the enthusiasm they had for this technology, it took me straight back to the first time I'd put on a headset, to that inspiring feeling that I felt in my master's, where I could see the excitement and the genuine kind of love of this technology, but more importantly, the prospects that they had for it, the ideas that they had. So basically this board is actually a whittled down version. At one point we had over 70 ideas for VR apps that could have a place in teenage oncology. So we basically kind of started to thematically group these, and we made this virtual cancer library, which obviously based on the kind of MetaQuest store. Some of them are existing apps, and other tiles we actually made ourselves, and a kind of more clear breakdown of the themes here and how many ideas we had around each. Most of the ideas centered around the kind of holistic care of young people with cancer. They viewed VR as being a really great supportive tool for them to kind of drive themselves. And what was really unique about this is they didn't just suggest an idea and then go on to the next. They kind of followed it through. They were like, well, what about if we had this app? But then, do you think our nurse could? Nah, the nurse wouldn't know how to use that. And what about? And they would have these kind of debates and discussions, and someone would be like, no, my nurse does. Like, she's really tech savvy and she's great. And they would kind of have these debates back and forth about who they could envision implementing this technology. And then, so they actually started grouping some apps as, okay, this one, no, I think there'd need to be a doctor that would deliver this one, and I wouldn't feel safe just with this one on my own. But then there was a lot of apps where they saw themselves as the drivers of this technology. So it was really interesting to see these kind of being fleshed out and becoming more than ideas. So basically, once we had these kind of app ideas and these brief descriptions, we moved into iterative design and prototyping of the ideas. So we chose a handful of ideas to take forward, and I've just put up a sample of some. And I mean, I'll just pick the first one as an example. When you read Mindfulness Hospital Tour, that's something that's spoken about a lot, you know, let a patient navigate the hospital and see their surroundings. But what was kind of, I started to find these nuances with the young people that so I said, you know, yeah, there's some things like that out there. And I said, but they then suggested that there would be 2 modes for this app. So one mode would be before you came into the hospital, you could navigate and understand. But then after, when you were actually in the hospital, you could switch the mode. And when you went to the room that you now knew was the waiting room and you'd been in it, it actually transformed into an enriching and emotional kind of positive emotion environment. And what's quite funny is I was like, oh, perfect, you know, mindfulness, relaxation, I'll take you to the beach. And they were like, no, I don't really think that. And they were like, well, why don't we just use generative AI to just create the exact environment that we feel like going in right there and then? And this is just why I love working with that population. Like, what an amazing suggestion. And it's something that, like, I hadn't even really thought of that. And I was like, why can't we? So sure enough, that's what we did. We then prototyped an app that allowed them to just type in a prompt and then think like of the exact environment they felt like going in. They'd walk in, waiting to see radiology, and they were in the middle of Tokyo. So it was really amazing to see their ideas kind of being fleshed out like this. So basically, once we had this idea, I've just put up kind of this is just a random example of one of our simulation app ideas, but this just to show you kind of the stage that we went through to actually design these apps. So we created storyboards for each one, and we picked out different scenes for them. So I had about 6 scenes for the storyboards. And then I would go away and kind of develop a low fidelity prototype in Unity. And I would come back next time and I would show them it, which was a hugely humbling experience because they were like, that looks rubbish. And then and I would say, okay, let's be specific though. And then they would have ideas straight away that even if I had presented a fully functioning, amazing looking app, they would have been the same, you know, critique as was in this kind of rubbish version. So there's a lot of learning from that. So what the stage we're in now is we're actually still engaged with this group of co-designers a year later, and we're asking every time we iterate on this app, we're going back to them and saying, okay, what do you think of it now? And we've moved into the second study now, which is a more evaluation, and that's when we're bringing in other young people with cancer that weren't invested and involved in the co-design process. So we're hoping they'll kind of have just a more objective evaluation. But we're also actually incorporating evaluation of existing apps. So this is the point where I wanted to say, okay, we've been doing it as if nothing exists, but now actually let's see what literature's done and what people are doing in other countries and what's worked. And this is when I will do a plug for the study. We are actually looking for any medical VR apps to trial, and I have NHS ethics in place, which if you have any idea about the UK's health system, you will know that is quite a miraculous thing to say here. So it's all set to go next month with a study. So if anyone is interested in trialling out an app on this demographic, please do get in touch with me. So basically, I wanted to talk a wee bit about the impact of this study. So at the offset, what I hope to learn about this study is, does VR have a place in oncology? And if so, what does that look like? But what really ended up being so interesting is not only did we generate novel kind of VR app ideas and hypotheses for research, and we also found kind of current commercial apps that could be reappropriated as mental health tools. But what I would say is the biggest, not the biggest, but a really interesting impact was when we empowered young people with cancer to have a voice in medical VR innovation, when we said to them, this VR is not being used in teenage oncology. You guys are the first people to be involved in this. What we found was suddenly the healthcare professionals were actually interested in medical VR. They were like, wait, what? There's been young people with cancer actually turning up to the same event time and time again. And if you've worked with teenagers, you'll know that is a very hard thing to do. And then the Cancer Trust were like, wait a minute, we've been running these peer support groups and no one's coming. And now they're all attending this one event. So suddenly, what we had was this community of VR where we had the National Health Service, the Teenage Cancer Trust, which are a big body of investment for oncology, and then we also had the university. So we had this, for the first time, a great collaborative interdisciplinary group, all excited about medical VR. And I'm going to give you just a quick bit of context as to why this was so exciting for me, especially in the UK. Just before this study, I ran an interview study with clinicians and healthcare professionals working in teenage and young adult oncology, and it's just about to be published in the BMC. And you can probably all guess what I found from this study without actually even reading the paper, which I shouldn't say because I'm going to encourage you all to read the paper. But as you can imagine, I suddenly started to learn all the reasons this is what we were waiting for, okay? And I suddenly realized, okay, we don't have Wi-Fi, that's quite a concern. And suddenly I started to understand why it was we didn't have medical VR in the UK. Now, we obviously had these challenges which to me felt so underwhelming, but actually are just really critical in all deployment of technology. These issues like obviously storage concerns, people were worried like who would charge it, or like it might get lost, or someone will take it home in their bag and we won't notice till a week later. These kind of challenges. To then more nuanced ones that are real concerns with VR, like clinicians, especially clinical psychologists, were really concerned that VR would just be a barrier between them and their patients. Then obviously, a lot of people just, this technology is alien, and they were quite intimidated by it, and they just thought, listen, we have shocking backlogs, we're just out of a pandemic, I don't have time for that. And whilst there was enthusiasm and they were excited about the prospect, obviously they'd signed up for this study, so they were excited and willing to be open to innovation for this demographic. But ultimately, what I started to realize, and even with my conversations with other clinicians and my funders, is in the UK, VR is just not actually considered an acceptable technology yet. We have not done the grassroots kind of initiatives that is needed to actually show people that VR is not just an enhanced entertainment system. And I think sometimes when something seems to be emerging for like a lot of years, you start to think, right, why are we not moving past it? Why are we still just up and coming? And why is this VR is just about to take off? And I think, obviously, we're all sold on VR, that we're here today. But in the UK, people are not. We're a public healthcare service, and there's a lot of challenges that come with that. Obviously, a lot of benefits too. But there's a lot of challenges for innovation in the UK, and if people aren't sold on the technology, actually even presenting clinical data to show how effective it is for their patients, it doesn't actually make an impact. So what I've learned is we actually need to start building a culture of VR and changing people's thinking if we want them to actually then read our studies and actually trial our technology. So I've sort of highlighted 3 next steps and key stages, I think, for the United Kingdom. And I would say the first one, building a culture of VR, and I hope that maybe by my first study, I've demonstrated quite a simple way of how you can do that. That was only 7 young people involved in that, but suddenly, I had to get ethics, so ethics were aware of it, the NHS were aware of it, my funders, the charity, the university. You can have a rippling huge effect from these small pieces of work. The second one, improved acceptance of VR technology. I think this is where we actually need to go back to kind of grassroots initiatives, going into schools, going into medical students that are excited about becoming doctors and innovating and using new technologies and changing their way of thinking. And then the third one is to demonstrate that VR can provide clinical benefit to patients. And yes, I'm talking about trials in this, but I'm also talking about the cost kind of analysis of it as well, which Harry obviously spoke a lot about in the Netherlands. We need to see that work in the UK because, especially for public healthcare service, investment and innovation is just really low in our priorities, and even lower is XR, I must say. Like, we're still looking at trying to get great electronic patient records, so me coming in with a VR headset is just like, oh God, please no. So we really need a lot of these grassroots initiatives to create these communities to then actually start demonstrating the clinical benefit and actually then the cost effectiveness as well in the UK. So that was a whistle-stop tour. I do want to do a shout out to some of the small groups in the UK that are doing amazing work. I realise I've made it sound like it's non-existent. We've got great companies like Oxford VR starting to do these smaller specialised trials within the NHS, and they are so important, and they're introducing VR in those smaller groups, but we need to see a lot more of it. And so yeah, thank you very much to the conference for having me, and please do get in touch if you've got anything.
Thank you very much.
Thank you. I think I went over, so.
Great talk. There's only time for one question.
Yep. Is my hair?
This gentleman.
Oh, sorry.
Sorry. We have a lot to talk about after the...
I'm curious with the kinds of solutions you described, the kinds of applications you described. Is there some kind of a distinction that you tried to make between this being an actual clinical tools for these patients, or more or less like a make-a-wish, like these are the most awesome toys we can give these kids having a hard time?
Mm-hmm. So we did actually group them in the kind of, I almost put an umbrella terms of the holistic care needs of young people, and under that bracket was ones that were more sort of to improve their mood and their mental health and all this kind of thing in the ward, and themselves be the driver of it. But we did have apps that definitely would fall under the category of being sort of medical tools rather than supportive tools, and that was mostly along the kind of clinical psychology route. So yeah, we did try and differentiate between apps that would actually need clinical input, and then also apps that were more supportive care that could be kind of interdisciplinary. So yeah.
Thank you very much.
Thank you. Thank you.